Hello, everybody, and thank you so much for joining me again at Advanced Training in Physical Therapy, where I am your personal athletic trainer and physical therapist. Today, we will be talking about tech neck. Now, a lot of you are probably wondering, what even is tech neck? So tech neck, also known as technology neck, is neck pain that's caused by repetitive strain and ultimately injury to the joints and surrounding structures of our neck, including our ligaments, tendons, bones, muscles, everything that's in that tiny little area. Now, your neck, also known as your cervical spine, has a natural C curvature. As we consistently look down at our phones all day, or we work at our computers, which maybe don't have the best setup, we start to change this overall structure of our spine. So in normal positioning, our head weighs about 11 to 12 pounds. But as we consistently look down for countless hours in the day, I know we all do it, we begin to form a forward head posture. So this posture increases the weight of our head to as much as 60 pounds. Now just imagine that, 60 pounds weighing down on your head and having to use your muscles to try and hold it up. Of course, as you probably guessed, this not only isn't sustainable, we can't do this for very long. Our neck adapts to these changes, these constant forces that are put on it. So what happens is, not only do we have a hyperflexion at our lower neck, but then we have to hyperextend our upper neck, otherwise we'd be staring at the floor. This forward head posture is commonly seen with muscle imbalance patterns. It's characterized as overactivity or tightness of your upper trap, your levator, your suboccipitals, as well as your sternocleidomastoid and your pecs. You also have reciprocal weakness on the other side of that coin, meaning your deep neck flexors and your lower scapular stabilizers like your rhomboids and your serratus anterior are no longer active, so it causes that constant hunched forward type posture. Our body actually learns new neural pathways in our central nervous system, and we memorize this motion and make it seem like it's our normal. This is called neuroplasticity. So our body basically learns that this new normal, which is wrong, is good for us, and we can still do things this way, and this is how we're supposed to be. But unfortunately, this causes serious issues down the road. Now that you have a little bit more information about what tech neck is and its negative effects, the next step in today's episode is to provide you with exercises and ways to prevent this issue from happening to you in the future. So this upper cross syndrome is basically going to be the key to our treatment here. So the first exercise I'm going to be showing you guys today is called a chin tuck. So this can be performed sitting or laying down. I just find that doing it against gravity has the best benefit for these muscles and to get them active. So the position you're going to be in is laying down on your back. You can do it on your bed or a harder surface, and you can put a little towel roll under the base of your skull there. This is going to provide you some tactile cueing. Really, this is just to give your head some feedback in terms of what direction you need to push into. So what you're going to do is you're going to take the back of your head, you're going to press it down into that towel, and at the same time, you're actually going to tuck your chin down towards your chest just a little bit. In reality, you're kind of giving yourself a little bit of a double chin. So when in doubt, give yourself the double chin. When you hold this position, you're going to stay there for about 3 to 5 seconds. This is really going to activate those muscles. After the 3 to 5 seconds, you can go ahead and relax your head, and you're going to repeat this exercise 10 to 15 times. And I like to do about 1 to 2 sets, depending on what's comfortable for you. Again, pulling back, holding. This is that great exercise to try and get those inhibited neck flexors back in action. The second exercise I'm going to be showing you today is actually a stretch. So what we're going to do for this stretch is to stretch out our pecs. You can have your arms down by your side if you have some shoulder pain, or you can go to your shoulder height to give an even better stretch. So you're going to split your stance. One foot's going to be in front of the other just to help to give you some balance. Your arm is going to be up onto the door frame. You're going to lean forward while keeping your arm rested on the frame and actually rotate away from your arm. I like to hold this stretch for about 20 to 30 seconds to really get the muscle to actually relax. I don't want any bouncing here because that can cause some strain and possible tears in the muscle. I just want a sustained hold, again for that 30 seconds, and then relaxing. I like to keep everything even, so you're going to do both sides about 2 to 3 times. The third exercise I'm going to give you today is an exercise to help to activate muscles that retract your shoulder blades. Today what I'm going to do is show you on your tummy, because I'm not assuming that everybody has resistance bands at their home. So as you're on your tummy, you're going to lay your arms flat, palms facing up. As your palm's facing up, you're going to actually try and squeeze your shoulder blades together, acting like you're cracking a nut between them. So as you do this, your shoulders and your arms will actually come up off the table. You'll hold that position against gravity again for about 2 to 3 seconds, and then you will relax. The last exercise that I'm going to show you today is actually another stretch for your upper trap and your levator muscles, which again are very tight when we are in this upper crossed syndrome posture. What you're going to do is to first stretch your upper trap. You're going to sit nicely in a chair with good posture. You're going to bring one ear down to your shoulder, and you're going to hold that positioning again for about 30 seconds. For some people, if you don't feel a good stretch when you do your ear to your shoulder, you can actually take your hand and you're going to provide a little bit of overpressure. Again, I like to keep everything even. You're going to do both sides. I like to do 2 to 3 times of 30 seconds each. The next stretch we're going to do is for your levator specifically. So what you're going to do is your nose is actually going to come down towards your armpit. You're going to hold that position for, again, about 30 seconds, and then you're going to relax. Again, you can use your hand to apply overpressure towards that side to get a better stretch. And I'll show you again here, going to the other side. Nose to armpit, holding for that good 30 seconds. With all of these exercises and stretches, I always want to make sure that my patients are not having any pain. Again, just another disclaimer, although I am a certified physical therapist, I do recommend that you reach out to your doctor before performing any of these exercises. Again, these are things that have worked for me personally and my patients. However, it may not work for you. Hi everyone, thanks so much for watching my video. If you guys have any questions, please leave them below in the comments. Don't forget to like and subscribe. Please share my video to as many viewers as you can. And as always, we're better together.